Thank you one and all for coming. Our presentation today is about diabetes. And as we go through his presentation, you'll understand it's a very personal topic, especially for Justin. And a lot that all of us research this fascinating topic. Diabetes is a disease, a human disease that affects the body's metabolism. And it occurs when the pancreas, which is a gland inside your body, fails to produce a hormone called insulin. Insulin is in your bloodstream, and it helps the blood transfer a sugar called glucose to the various cells in your body, muscle cells, liver cells, and your fat cells. And if the cells cannot absorb the glucose, the sugar stays in your blood, and you'll get what is referred to as high blood sugar. And what happens with high blood sugar is often the symptoms are excessive urination, you're hungry, or you're always thirsty. And they can test this by looking for elevated blood sugar levels in your blood, and they can look for sugar in your urine. These are all medical tests that doctors can perform. There are two types of diabetes, and type 1 is what they refer to often as juvenile onset diabetes, and it occurs in children and young adults, almost always if they're younger than 25 years of age. They don't know what causes it, and currently there is no cure. It is incurable, and 3 to 5% of all diabetics are type 1. Type 2 is a little different than Type 2 is a little different than type 1. Type 2 can occur at any age, and it can be caused by stress, pregnancy, obesity, an injury. Often you'll hear women who are pregnant become diabetic, and they refer to that as gestational diabetes. It comprises 93 to 95% of all diabetics, so there's a huge number of diabetics out there in the world who have type 2. But it's becoming more frequent in younger people because of obesity. Kids aren't active as much as they used to be or should be, and they're finding that these young people are getting diabetes when it used to be just older people or people out of shape or obese people getting it. Failure to recognize the symptoms, the onset starts with you can get nauseated, headaches, vomiting, ultimately go into a coma or even death. If you know you've got diabetes and you don't treat it, you stand a very good chance of getting an infection. And it affects the capillaries in like your feet and your fingers and your toes, and you cannot fight off infections. People who have diabetes have to be fastidious about their foot care. The least nick, the toenail nicks your skin, can get infected, and your body won't be able to fight the infection, and it leads to a lot of gangrene and amputations. You also have an increased risk for stroke and heart disease. There are medical tests, and involve drawing blood and looking for glucose and hemoglobin levels in the blood. And fortunately, type 2s can often control their disease through diet and exercise. And often you can prevent getting type 2 diabetes by maintaining a proper diet and an active lifestyle.
And I'm going to talk to you a little bit about some history of diabetes. Diabetes is one of the oldest known diseases, and its official name is called diabetes mellitus. That's how you say it.
Mellitus.
Mellitus? Okay. And so diabetes, that word comes from, it's a Greek word that means, or siphon, which means a tube used to drain liquids. And then later on they added the word mellitus because that word means honey in Latin, and that described the sweetness that was found in the urine. Today, diabetics have a lot of options, but it wasn't so easy to control the disease and manage it in the past. In the olden days, it was just hard to be able to even know what it was. As mentioned, one of the main signs was frequent urination. And so actually, the Indians, the way they used to test for this was that they used ants. And so if ants were attracted to the urine, that showed that there was, it contained high sugar levels in that. And since so there was very little knowledge and technology available during the time, people just tried to fight the disease the best way they knew how. And in prior to 1922, one of the diets was an Allen diet, and this was extremely low carbohydrates and low calorie diet. But however, that just really let people live only a few weeks or months longer. And it wasn't until the 20th century that a lot of the treatments changed. A man by the name of Frederick Banting, I'm sorry to get his picture on there. He was a Canadian man. In the 20s, he later won the Nobel Peace Prize for his discoveries. And he began experimenting with dogs. And one of the quotes that I found, it says, the dog's blood glucose levels were brought under control by one of the fluids he called insulin. And so not long after that, they decided to test it in humans. And there was an 11-year-old Canadian boy who was given the first shot of insulin from a cow, actually. And so the results were successful, and he became healthier, and the glucose levels became normal. But in the beginning, insulin did cause problems. People did become sick, and they had allergic reactions. The only way they could get insulation into the body was by using the glass syringe and using sterilized needles. And that was sometimes during the process of preparing and stuff, the insulin would become contaminated, and that's what made people sick. It also took a lot of carefully planning out and measuring this, and you would you'd have to take it sort of on an as-needed basis. And for the diabetic population, they really pushed for more of a once-a-day type of treatment. And they did finally develop something like that, but what happened was it said there was a long type of insulation that was developed, but patients taking these had higher rates of blindness, kidney failure, and nerve damage, and those individuals had to be than the individuals that were treated by multiple injections. So in 1950, they developed some oral medications that people could start taking, and then by the 1960s, people could begin doing their own testings with urine, different samples they could do at home. And then in the 70s, tests were invented to measure the glucose levels in one's blood. And so over time, there's been a development that it progressively gets better. And then Justin's now going to talk about what the current developments are.
Well, this is definitely a subject that's near and dear to my heart. My wife has been diabetic since she was 8 years old as a juvenile diabetic. And I can tell you now that technology has totally changed her lifestyle and her better quality of living. Insulin, there are many different types of insulin. How you take your insulin really depends on your diet, your activity levels. There's many professional athletes that are actually diabetic. Jay Cutler is the quarterback for the Chicago Bears is diabetic. Your genetics, your lifestyle, all that plays into the type of insulin that you eat and your diet and all that. There's many different types. There's over 40 different types of insulin. There's fast-acting, short-acting, intermediate-acting, long-acting, and pre-mixed, where they actually mix some different insulins together. And the reason why there's so many different types is based on the lifestyle and diet. If you're an athlete, before you go to bed, when you're not active, you need a long-acting insulin. They came out with a new one called Lantus about 5 years ago. My wife was on before the pump, and she would actually take that before bed. And what it would do is it would slowly release that insulin into her bloodstream during the night. Instead of taking a shot and it all hits her just at once, it's slow acting. So that's why there's so many different kinds. Blood glucose meters have changed a lot over the years. There's the traditional meter where you can take on the go, take it home, where you just prick your finger, put it in the machine, and that will give you your blood sugar. There's meters that test alternative sites. So not only do you have to just prick your finger, you can prick your arm, you can prick your leg, other areas of your body. They now actually have lasers that can check your blood sugar and actually penetrates your first layer of your skin and can read the actual liquid underneath your skin and how much sugar's in it. And one of the most important ones that came out, in my opinion, is the MiniMed, that's the name of the company, Medtronic MiniMed, continuous glucose monitoring system. And what makes this so important is that the insulin pump, this actually communicates with that. So you actually have two tubes that go into you, one to inject the insulin, and then one to actually read the blood sugar. And the tubes look very similar to this, and I'll pass this around. The insulin actually travels through this little tube. It can be 3, 4, 2 feet long, depending on where you want to place your pump. And so basically these two things, this pump communicates together with the injection of the insulin and reads what your sugar is and determines what you need. There's also a glucose watch, basically a glucose watch. You can wear a watch, you can measure your sweat and your oil on your skin, but the actual accuracy of that is still under interpretation. The insulin pump is very important, and that's what my wife went on a couple of years ago. And what makes it so important is that you can set it to inject insulin at certain times during the day. So basically what the technology has done is kind of taking some of the functions of the pancreas, instead of that being inside your body, and placing it outside your body. So basically you have this pump, it kind of looks like a pager. It has controls, a processing module, and batteries. It has a disposable reservoir, which is like a cylinder, which is what the insulin goes into inside the pump. It has an infusion set, which is partially, this is like 50% of it. How it works is there's actually a needle that goes inside your stomach or your quadricep. And it has a needle inside of it, and around it is a clear plastic tube. So you inject it with the needle, you pull the needle out, and the tube stays in. And that stays in you for 3 days. And that's how the insulin gets injected into you. It's got a cannula for subcutaneous insertion under the skin. That's that clear plastic tube. And the tubing system is like what I showed right there. I'm going to show a YouTube video. I'm going to show this video just because it really shows a young gentleman, a youth boy, a juvenile diabetic. It shows the family interaction of like how serious this is and really how technology is really increasing the lifespan of the people.
Can we see 1 minute of it? So
Yeah, I'll try.
I'm priming the pump. Priming the pump gets out the air out of the insulin, out of the tubing. You just hold down the button until you start to see the drip. After you've seen the drip, you push escape, get back to the main menu.
What do you think about the pump, Brent?
I like it.
You like it better than doing the shots every day?
Yep.
How many shots were you doing before the pump a day? Doing more than that. Doing 6.
Before you put your needle into this thing, do not pull out the blue, this blue right here. Do not pull it out because it's inside of the tubing. Only pull this out after it's on the site. Have you primed your stomach? Take your shirt off.
I'm gonna do it right there where I put the header. That's why I took it off.
Where did you put it? Don't forget how you're gonna fix the tubing.
Make sure you have show them how you're going to do the tube so it comes out the bottom.
Make sure you have the tube pointing like that way so it goes directly to your
To
pocket.
your pocket.
So basically, that stays in here for 3 days, and after 3 days, he will switch that out to another piece. And so now he can just adjust his meter to get the insulin to go into the system. My wife does that exact same thing. The reason why this technology is so important, researching this, according to a study presented at the American Diabetes Association, the life expectancy from the groups diagnosed between 50 and 64 was only 53.4 years, compared with a life expectancy of almost 70 years for the group diagnosed between 1965 and 1980. And that is just comparing old technology. That's not even comparing this newest stuff that just came out. So basically, this technology is extending the life of people with diabetes. It's making, you see young gentlemen like this who are able to have a more functional life, participate in sports, sleep better at night, not be worried about going low, and they can have more control over their insulin intake. And Mark's going to talk about some of these right now.
Thank you, Joseph. Well, as we've talked here, it's a very serious condition, diabetes, whether it's type 1 or type 2. And the Holy Grail, obviously, is a cure. So, unfortunately, since there are two different avenues of diabetes, that means that the research money is split into two areas as well. So a cure isn't as quick to come as it might be if it was just one single disease. As Ralph said, type 1, they think it's basically an autoimmune disease where your body is actually attacking the pancreas-creating cells. I'm sorry, the insulin-creating cells in your pancreas. Whereas type 2 also can be genetic, and there are certain ethnic groups that can be predisposed to it. But the vast majority of type 2 diabetes is caused by sedentary lifestyle and obesity. So for the research that they're doing for type 1, they're looking into what's called T regulatory cells. And what they're basically trying to do is manipulate these cells to make them stop the destruction of the pancreas, of the insulin-creating cells. So introduce this new cell into your body that basically suppresses your body's immune system that is currently attacking your good cells, and then let the body heal itself. They're also looking into gene therapy. Again, one of the ideas is that your immune system is attacking these pancreas cells. So what they're trying to do is disguise or create a cell that isn't a pancreas cell that can still create insulin. And then put that in the body with the hopes that the body won't recognize it as a pancreas cell, and it can go on and do its duty to create insulin for you. For type 2, again, it's a different avenue of research. The triggering mechanism for it, and it often is obesity and sedentary lifestyle. And for most people, simple weight loss and exercise will essentially cure diabetes, type 2 for you. For some people, though, they're past that point, and for people that they feel or that have what they call morbid obesity, which is a body mass index of 40 or greater, they're actually doing researching a type of gastric bypass surgery, not the type that you hear about, if someone goes in for lap band surgery. This is actually where they're going in, and they call it a biliopancreatic resection, and they're actually removing part of your intestines and rerouting your insides to reduce the ability of your body to absorb all of the fat. Unfortunately, that also sometimes causes severe malnutrition, but for these people that they're doing it for, it's a matter of life or death, essentially. For those that aren't so morbidly obese, another thing that they're researching is called vanadium salts. And this is something that can normalize the blood glucose levels. And because of that, it could help both people with type 1 and type 2 diabetes. So that is our paper. We each have our own conclusions. Ralph, you want to take it off?
Type 1, I have a personal connection to it. Years ago, when my youngest son had a playmate that just lived down the street from us, and one day I got a phone call that my son Ben and his friend Jeffrey got arrested or got in trouble for shoplifting and he stole candy from the candy store. And I was really upset about that. And I you know, why? Well, why steal the candy? Well, I didn't know if Jeffrey was type 1 diabetic. He's not allowed to have candy at home. And I was stunned that, you know, here's a young man, you know, I can't imagine a kid without candy, and you just couldn't imagine a life without it. All his friends did. And Jeffrey died when he was 8 years old, so it hit home very early for me how bad it was and how blessed I was to have children that didn't have diabetes.
I would just like to conclude that I am personally thankful for the technology that is available in this day and age. Not only does diabetes help the individual, but it also helps them have a better quality of life. If they want to start a family, it helps out. You know, pregnancy, we just had our first child in June, and 20 years ago they might have said it's not a good idea for you guys to even attempt to have a child due to birth defects and such. And now it's much more common to go ahead and go, get the green light, like, hey, it's okay. So I am just very fortunate to live in this day and age where we have this technology, and I only see this moving forward with new discoveries as works on the genetic level, cell level, as well as the electronic level, and the materials that are being used. I just hope that this technology can also be given to people who may not be able to afford it, and helps the healthcare system get children like the one in the video, because what this does is enable them to live more. If y'all didn't know, insulin comes from pigs, almost all of it. It comes in bottles like this. And there's an event in town in Champaign, it had been refined over the last couple of years called Kiss a Pig. But it's good if you guys know anybody with diabetes to support them. Supported the ADA, and I did pass out some pamphlets you guys can read a little bit more on at different types. But altogether, I'm just grateful for the technology, the research, and moving forward to years to come. It's going to provide my wife and my family a better quality of living. So that's all I have.
And then my conclusion is basically that the use of technology is tremendous for those with type 1 diabetes. They're born with it. They didn't do anything to get it. It just happened to them. So it's wonderful that there are efforts to help cure them. Type 2 diabetes, as we talked kind of last week, I think it's kind of a double-edged sword. I mean, I'm up here, I'm overweight, I'm sedentary. I'm looking at, a possible future of diabetes if I continue down the path that I'm on. And I think Rebecca had said in one of our discussions about this paper, that it's kind of been eye-opening to me to really bring this home. That it's basically the technology. So, sorry, the double-edged sword is, again, the technology that we got to control it also brought us here. With our sedentary lifestyle, we're not out hunting and gathering for our food. We're using washing machines, cars, etc. for labor savings, and that's why there's such a huge growth in the United States in particular for type 2 diabetes. And there's a search for a cure, but for most of us, exercise and weight loss and a maintenance of a healthy weight would get us there without any further research. You guys have any questions for us? Yes.
Let us first give them a hand for this work. There's a question.
For your wife, how long, kind of like after she picks an injection site and it's moved on to the next one, like, I don't know, kind of, what's it like? Like, does it hurt? Like, how, can she go back to that site later? Like, how long is that? Just kind of like, I don't know.
It's really interesting. My wife is a really active person. She's always on the go. My wife is not overweight by any means, so that did not play a part in her. She just got it. It's not hereditary. When it comes to the site, it really depends a lot on her lifestyle. Like if we're going on vacation or if she has a work presentation to do, because the pump can be placed at they have so many different apparatuses to where you can place the pump at different locations. You know how like in James Bond, you put like a gun on your thigh. You can put your pump on your thigh. You can put your pump on in your pocket like the boy did. You can they make bras with a little holder. You can put the pump there. And so she really picks her site location based on what her body's telling her. So if she's used this site, and you can feel the tissue is a little different, she'll pick like the other side, or she'll do her thigh, which now they can go below the waist. I know you said above the waist, but you can go near like quadricep area. And those are, so she pretty much uses her stomach area and then her upper leg areas. And she does that based on what's comfortable for her. So, yes?
Other questions?
Fine, Sydney.
Does insurance cover like the pumps and the, like, is that a standard coverage thing?
Yeah, insurance is different, of course, amongst companies. My wife covers it. I have health plans now, thank gosh, because I just got a job for you to buy, so thankfully. But before I used to work at Walmart, and my wife used to work at a different bank than the one she's at now. She's a mortgage lender. And I think we paid for the pump roughly $3,000 under that insurance plan. Like he works at Healthline, so he'll you know, so every insurance company is different. I mean, the better insurance you have, the more opportunity you have to better take care of yourself. And it's not just, hey, I need to get a pump, but there's so much supplies. There's test strips, there's insulin, there's alcohol, and there's just so much stuff you have to use on a daily basis. So many materials, and it's all, if you had to pay for it all out of pocket, you would go bankrupt. It's so expensive. But yeah, we're just grateful to have insurance plays a huge part, yes.
What I've learned just from insurance in general, if insurance pays for it, that means it works. You know, that it better manages you, makes you healthier long term, so that there aren't further costs down the road.
More questions here?
If you didn't have insurance, if you knew someone that does not have insurance, how would you afford that? Are there any places that you can go and get treatment for this?
I'm not exactly sure. From a juvenile standpoint, I'm sure there is. There's a lot of camps, there's a lot of organizations, there's a lot of fundraisers. The ADA, the Diabetes Association, provides a lot of that. They will get families the best care that they possibly can. Unfortunately, in some cases, like the pump is probably the most expensive because these tubes and reservoirs and all these supplies are very expensive. So a lot of the times they resort back to the bottle and the needle. So if you don't have insurance, this is what you can afford. So you may not get the cutting edge technology. There's even adults that I know that still use this, and I'm like, why? I worked with a guy at Allstate who was in his 40s who was diabetic, and he actually, me and my wife took him out for dinner, him and his wife, and introduced him to the pump, and within a couple of months he was on it, and he has done so much better. So, I mean, a lot of it is knowledge. A lot of people don't know and choose insurance and money.
Another question, please.
Yes.
You said the pump performs the same functions as the pancreas, right? So
It does not perform the same function. Nothing will perform the same functions as the pancreas.
Okay.
But it will perform similar functions. It's more close to how the actual pancreas works because your body doesn't know what it's eating until you put it in. And your body reacts to that based on the carbohydrates you take in that are going to turn to glucose. So basically what a lot of diabetics do is carb count. And on this meter, when you do a food intake, you still have to pay attention to your nutrition. You count your carbs and you adjust that basal rate on your pump. And that adjusts. You can put so all you have to do is enter your carbs. So if you had 15 carbs, you put in 15, the machine will adjust that basal rate for the insulin to go into you.
Any other questions? I have a question about diabetes 2. Why is it to take it from fingers? Is the blood in the fingers different than any
Because it's at one of your extremities, so it's one of the most important places to test. Because with diabetes, the health effects, once they start to decline, affect your vision, affect your fingers, affect your feet. And just like as Rob was saying, my grandma was a type 1 diabetic, and she lived to be 55 years old. My mom was adopted, so there's no hereditary line with her particular, but she got a sore on her heel. It turned to gangrene, and she had to end up eventually having both of her legs amputated above the knee. And she died in, I think, the early 90s. And it was just horrific to see this happen. And luckily, this technology has really changed that, increased the life expectancy. And like feet care is very important. I was at the doctor today, and it said on the wall, if you're diabetic, go ahead and remove your socks now. Because doctors, that's very important, that care.
Well, I think we can give them a round of applause again.
You can prevent getting type 2 diabetes by maintaining a proper diet and an active lifestyle.
And I'm going to talk to you a little bit about some history of diabetes. Diabetes is one of the oldest known diseases, and its official name is called diabetes mellitus. That's how you say it.
Mellitus.
Mellitus? Okay. And so diabetes, that word comes from, it's a Greek word that means, or siphon, which means a tube used to drain liquids. And then later on they added the word mellitus because that word means honey in Latin, and that described the sweetness that was found in urine. Today, diabetics have a lot of options, but it wasn't so easy to
Type 1. Type 2 is a little different than type 2 is a little different than type 1. Type 2 can occur at any age, and it can be caused by stress, pregnancy, obesity, and injury. Often you'll hear women who are pregnant become diabetic, and they refer to that as gestational diabetes. It comprises 93 to 95% of all diabetics, so there's a huge number of diabetics out there in the world who have type 2. But it's becoming more frequent in younger people because of obesity. Kids aren't active as much as they used to be or should be, and they're finding that these young people are getting diabetes when it used to be just older people or people out of shape or obese people getting it. Failure to recognize the symptoms, the onset starts with, you can get nauseated, headaches, vomiting, ultimately go into a coma with your fat cells. And if the cells cannot absorb the glucose, the sugar stays in your blood, and you'll get what is referred to as high blood sugar. And what happens with high blood sugar is often the symptoms are excessive urination, you're hungry, or you're always thirsty. And they can test this by looking for elevated blood sugar levels in your blood, and they can look for sugar in your urine. These are all medical tests that doctors can perform. There are two types of diabetes, and type 1 is what they refer to often as juvenile onset diabetes, and it occurs in children and young adults, almost always if they're younger than 25 years of age. They don't know what causes it, and currently there is no cure. It is incurable, and 3 to 5% of all diabetics are Thank you one and all for coming. Our presentation today is about diabetes. And as we go through this presentation, you'll understand it's a very personal topic, especially for Justin, and a lot that all of us research this fascinating topic. Diabetes is a disease, a human disease that affects the body's metabolism. And it occurs when the pancreas, which is the gland inside your body, fails to produce a hormone called insulin. Insulin is in your bloodstream, and it helps the blood transfer a sugar called glucose to the various cells in your body, muscle cells, liver cells, or even death. If you know you've got diabetes and you don't treat it, you stand a very good chance of getting an infection. And it affects the capillaries in like your feet and your fingers and your toes, and you cannot fight off infections. People who have diabetes have to be fastidious about their foot care. The least nick, the toenail nicks your skin, can get infected, and your body won't be able to fight the infection, and it leads to a lot of gangrene and amputations. You can also have an increased risk for stroke and heart disease. There are medical tests and involve drawing blood and looking for glucose and hemoglobin levels in the blood. And fortunately, type 2s can often control their disease through diet and exercise. And often